देखते ही देखते साल 1963 में सेवा, संघर्ष और स्वास्थ्य विकास के पंखों को उड़ान दे रहा था। तब 1960 के दशक में पंजाब की राजधानी बने चंडीगढ़ में पीजीआई बनाने को लेकर एक विचार उभरा और देखते ही देखते साल 1963 में सेवा, संघर्ष और स्वास्थ्य के सफर की शुरुआत हुई। साल 2014 में आई मोदी सरकार के लगातार प्रयासों और सहयोग का ही नतीजा है कि 277 एकड़ में फैला पीजीआई वर्तमान में 9 सेंटर्स, 2 रिसर्च ब्लॉक्स, 47 विभागों और तकरीबन 728 फैकल्टीज के साथ स्वास्थ्य क्षेत्र में अग्रणी भूमिका निभा रहा है। साल 1963 में नेहरू हॉस्पिटल से शुरू हुआ इसका सफर आज पंजाब के संगरूर में सैटेलाइट सेंटर तक पहुंच गया है। नेहरू हॉस्पिटल के बाद रिसर्च ब्लॉक ए, रिसर्च ब्लॉक बी, एडवांस पीडियाट्रिक सेंटर, एडवांस कार्डियक सेंटर, आई सेंटर, ड्रग डी एडिक्शन ट्रीटमेंट सेंटर, इमरजेंसी, एडवांस ट्रॉमा सेंटर, ओपीडी और नेहरू हॉस्पिटल एक्सटेंशन बिल्डिंग का विस्तार हुआ है। आने वाले सालों में कई और बिल्डिंगें पीजीआई में बनकर तैयार हो जाएंगी। सहारनपुर में भी 50 एकड़ जमीन मिल चुकी है, जहां एक मेडिकल कॉलेज और अन्य उन्नत केंद्रों की स्थापना के लिए योजना बनाई जा रही है। वर्तमान में न्यूरो साइंसेस केंद्र और मातृ एवं शिशु स्वास्थ्य केंद्र परियोजनाओं पर काम चल रहा है। इसी साल 25 फरवरी को प्रधानमंत्री श्री नरेंद्र मोदी जी ने वर्चुअल माध्यम से संगरूर अस्पताल का उद्घाटन और फिरोजपुर अस्पताल की नींव रखी। वहीं पीजीआई सैटेलाइट सेंटर ऊना पर भी काम जोरों पर चल रहा है। इंफ्रास्ट्रक्चर की बात करें तो वर्तमान में पीजीआई में बेड्स की संख्या लगभग 2233 है। वहीं आईसीयू बेड्स की संख्या 207 और ऑपरेटिंग रूम्स की संख्या 73 है। क्लिनिकल सेवाओं के अलावा पोस्ट ग्रेजुएट और पोस्ट डॉक्टरेट डिग्री, डिप्लोमा, डॉक्टर ऑफ फिलॉसफी और फेलोशिप सहित चिकित्सा के लगभग सभी विषयों में प्रशिक्षण भी प्रदान करता है। नतीजतन पीजीआई में पढ़ने आने वाले छात्रों की वार्षिक संख्या भी 936 तक पहुंच गई है। यही नहीं, भारत में पहली बार पीजीआई चंडीगढ़ ने क्लिनिकल फोटोग्राफी विभाग के तहत मेडिकल और वैज्ञानिक फोटोग्राफी, इमेजिंग तथा एनिमेशन पर 3 साल का डिग्री पाठ्यक्रम शुरू किया है, जो पूरे एशिया में अपनी तरह का एकमात्र कोर्स है। पीजीआई के आंकड़ों पर नजर दौड़ाएं। साल 2023 में आईपीडी मरीजों की संख्या 1,01,536 है। वहीं ओपीडी में मरीजों की संख्या साल 2014 में 21,84,591 थी, जो अब बढ़कर 27,05,020 हो चुकी है। संस्थान में साल 2023 में तकरीबन 52,373 मेजर ऑपरेशंस और 36,329 छोटे ऑपरेशंस को सफलतापूर्वक पूरा किया जा चुका है। दूसरी ओर इमरजेंसी में आ रहे मरीजों की संख्या साल 2023 में लगभग 1,10,590 तक है। वहां किए जा रहे ऑपरेशंस में 18,523 बड़े यानी मेजर ऑपरेशंस और 2,058 छोटे ऑपरेशंस शामिल हैं। स्वास्थ्य के क्षेत्र में अपने उच्चतम मानकों की परंपरा को जारी रखते हुए पीजीआई ने रोटो के रूप में शव अंगदान को बढ़ावा देने की दिशा में उत्कृष्ट योगदान के लिए सर्वश्रेष्ठ अस्पताल श्रेणी में 4 बार राष्ट्रीय पुरस्कार जीतकर गौरव हासिल किया है।
तुम भी चलो, हम भी चले, चलती रहे जिंदगी। तुम भी चलो, हम भी चले, चलती रहे जिंदगी। ना ज़मीं मंजिल ना आसमां, जिंदगी है जिंदगी।
साथ ही ब्रिटिश मेडिकल जर्नल 2019 द्वारा पीजीआई को देश के सर्वश्रेष्ठ अस्पताल का पुरस्कार भी मिल चुका है। पिछले ही साल राष्ट्रीय संस्थागत रैंकिंग फ्रेमवर्क द्वारा पीजीआई को स्वास्थ्य क्षेत्र में देश भर में दूसरा स्थान मिला है। साल 2015 में ब्यूरो ऑफ एनर्जी एफिशिएंसी भारत सरकार की ओर से एडवांस्ड कार्डियक सेंटर और एडवांस्ड आई सेंटर को स्टार रेटिंग दी गई है। साथ ही साल 2015-16 में स्वच्छ भारत मिशन के अंतर्गत कायाकल्प पुरस्कार के 5 करोड़ रुपए का पहला पुरस्कार पीजीआई के नाम रहा। आज भारत दुनिया के सबसे बड़े स्वास्थ्य सेवा कार्यक्रम आयुष्मान भारत का नेतृत्व कर रहा है। आज चाहे एंटी कोविड-19 वैक्सीन हो, टेलीमेडिसिन, अस्पताल में रजिस्ट्रेशन हो या स्वास्थ्य रिकॉर्ड तक पहुंच की बात हो, स्वास्थ्य सेवा अब नागरिकों की उंगलियों पर उपलब्ध है। मोदी सरकार और स्वास्थ्य मंत्रालय ने डिजिटल स्वास्थ्य क्रांति लाने की दिशा में पीजीआई के आधारभूत ढांचे को मजबूती देने के लिए कई सराहनीय पहल की हैं।
As far as the online services is concerned, it's going to give us really, the patient will really be able to utilize the services and save the hours of the faculty, the health faculty members also, and at the same time he'll be able to save his own time.
इसकी शुरुआत साल 2014 में सरकार बनने के साथ ही पीजीआई में टेली एविडेंस की सुविधा शुरू होने के साथ हुई।
I would like to congratulate because PGI is the first institute in the country where this tele-evidence facility has been created.
इससे पहले संस्थान के डॉक्टरों को अदालत में पेश होने के लिए लंबी दूरी तय करनी पड़ती थी, लेकिन टेली एविडेंस सुविधा शुरू होने के बाद बिना समय गंवाए अब डॉक्टर्स अदालत की कार्यवाही में संस्थान के भीतर से ही भाग ले सकने में सक्षम हैं। वहीं 2015 से पीजीआई में ऑनलाइन प्री रजिस्ट्रेशन किया जा रहा है। इसी की तर्ज पर ऑनलाइन लैब रिपोर्ट की सुविधा भी पीजीआई में उपलब्ध है। मोदी सरकार ने समय समय पर पीजीआई में अत्याधुनिक सुविधाओं के समावेश के लिए कदम उठाए हैं।
देश के धनी आदमी जिस प्रकार से आरोग्य की सेवा प्राप्त कर सकते हैं, अब मेरे देश के गरीब को भी वही सेवाएं उपलब्ध होनी चाहिए।
साल 2016 में बतौर स्वास्थ्य मंत्री जेपी नड्डा जी द्वारा किटन एमआरआई या मॉक एमआरआई स्कैनर को संस्थान को समर्पित किया गया। इसका उद्देश्य विशेष रूप से एमआरआई स्कैनिंग को बच्चों के लिए सुरक्षित और अनुकूल बनाना था। इस सुविधा से बच्चों को पहली स्कैनिंग लेने से पहले एमआरआई स्कैनिंग के वातावरण से अवगत कराया जाता है। इसके साथ ही स्वास्थ्य मंत्री ने ओएसए की बेहतर जांच और उपचार के लिए स्लीप लैब का भी उद्घाटन किया। पीजीआई के लिए ये गर्व की बात है कि ये लैब उत्तर भारत के ईएनटी विभाग में शुरू होने वाली पहली लैब है। वहीं 7 अप्रैल 2023 को रेडियोलॉजी विभाग में स्टेट ऑफ द आर्ट तकनीक से लैस 3 टेस्ला मशीनों का उद्घाटन श्री राजेश भूषण आईएएस सचिव स्वास्थ्य और परिवार कल्याण द्वारा किया गया। इसी दौरान उन्होंने एडवांस एटॉप्सी केंद्र का उद्घाटन भी किया। साथ ही 2019 में स्वास्थ्य मंत्री के रूप में श्री जेपी नड्डा जी की ओर से उच्च ऊर्जा लीनियर एक्सेलरेटर मशीन का उद्घाटन किया गया, जो बहुत छोटे आकार के लक्ष्य को भी बड़ी सटीकता के साथ इलाज करने की क्षमता रखती है। पीजीआई के डॉक्टरों, नर्सों, पैरामेडिक्स को बेसिक तथा एडवांस्ड लाइफ सपोर्ट में प्रशिक्षण देने के लिए राष्ट्रीय आपातकालीन कौशल केंद्र NELS स्थापित करने हेतु हेल्थ प्रोफेशनल्स को इन हाउस ट्रेनिंग भी दी जा रही है और जल्द ही उत्तर भारत के विभिन्न चिकित्सा संस्थानों के हेल्थ प्रोफेशनल्स को भी प्रशिक्षित किया जाएगा। दूसरी ओर पीजीआई अमृत पहल के अंतर्गत मरीजों के उपचार के लिए सस्ती दरों पर स्टंट और ऑर्थोपेडिक प्रत्यारोपण सफलतापूर्वक पूरा कर रहा है। स्वास्थ्य एवं परिवार कल्याण मंत्रालय की इस अनोखी पहल से भारत सरकार का लक्ष्य आमजन के जेब खर्च को कम करना है।
आयुष्मान भारत गरीब के जीवन को बचाने में अहम भूमिका निभा रहा है।
आयुष्मान भारत प्रधानमंत्री जन आरोग्य योजना 2018, जो भारत सरकार की एक अहम योजना है, जो 23 सितंबर 2018 को लॉन्च की गई थी, पीजीआई में अक्टूबर 2018 में लागू की गई। दुनिया भर में फैली कोविड-19 महामारी के दौरान पीजीआई में 3 स्थानों पर स्वास्थ्य कर्मियों के साथ साथ आम जनता को भी कोविड टीकाकरण करवाया गया। स्वास्थ्य एवं परिवार कल्याण मंत्रालय की ओर से जननी शिशु सुरक्षा कार्यक्रम JSSK को शुरू किया गया। इसके तहत गर्भवती महिलाएं मुफ्त और कैशलेस डिलीवरी, मुफ्त C सेक्शन, मुफ्त दवाएं, मुफ्त आहार, खून की मुफ्त व्यवस्था, घर से अस्पतालों तक मुफ्त परिवहन जैसी कई सुविधाएं दी जा रही हैं, ताकि मां और होने वाले बच्चे को सुरक्षित माहौल दिया जा सके। स्वास्थ्य सुविधाओं के डिजिटलीकरण को मोदी सरकार ने प्राथमिकता देते हुए उसके उपयोग को ज्यादा से ज्यादा बढ़ावा दिया है। सर्जरी में रोबोटिक्स के इस्तेमाल की परिकल्पना को साल 2015 में पूरा किया गया, जबकि इस अत्याधुनिक सुविधा को 8 फरवरी 2015 को शुरू किया गया था। पिछले कुछ सालों में पीजीआई में रोबोटिक सर्जरी की मदद से अब मुश्किल से मुश्किल ऑपरेशन भी बड़ी सटीकता और आसानी से किए जा रहे हैं। साथ ही इमेज गाइडेड रेडियोथेरेपी आईजीआरटी की भी शुरुआत हुई, जिससे मरीजों के इलाज में मदद मिल रही है। दिसंबर 2015 में सीएसआईसी यानी सेंट्रल सोफिस्टिकेटेड इंस्ट्रूमेंट्स सेल की शुरुआत हुई, जो संस्थान में रिसर्च के लिए अत्याधुनिक तकनीक की उपलब्धता सुनिश्चित कर रही है। साल 2021 में मरीजों के इलाज के लिए एक ही छत के नीचे क्लिनिकल हेमेटोलॉजी और मेडिकल ऑन्कोलॉजी की शुरुआत की गई है, जिससे प्रशिक्षित और अनुभवी मेडिकल डॉक्टर्स बेहतरीन तरीके से कैंसर के इलाज में मदद कर पा रहे हैं। वहीं सुपर स्पेशलिटी सेवाओं के चलते पीजीआई के सर्जिकल गैस्ट्रोएंटरोलॉजी डिवीजन को स्वतंत्र विभाग का दर्जा मिल चुका है। वहीं नेहरू हॉस्पिटल एक्सटेंशन बिल्डिंग, जो ग्रीन बिल्डिंग कॉन्सेप्ट पर आधारित एक अत्याधुनिक परियोजना है, इसमें ओटोलिरिंगोलॉजी, एंडोक्रिनोलॉजी, हेपेटोलॉजी और रेडियोथेरेपी के विभाग साल 2022 से अपनी पूरी क्षमता के साथ काम कर रहे हैं। जहां स्वास्थ्य सेवा अब विशेषाधिकार नहीं रह गई है,
भारत की अप्रोच सिर्फ हेल्थ केयर तक ही सीमित नहीं, बल्कि हम एक कदम आगे बढ़कर वेलनेस के लिए काम कर रहे हैं।
प्रधानमंत्री श्री नरेंद्र मोदी जी ने पीजीआई में स्वास्थ्य सेवा को सभी की पहुंच में लाने के लिए टेक्नोलॉजी का क्रांतिकारी उपयोग कर स्वास्थ्य को पंक्ति के आखिरी छोर में खड़े व्यक्ति तक उपलब्ध करवाने का काम किया है। आजादी के बाद जब भारत विकास के पंखों को उड़ान दे रहा था, तब 1960 के दशक में पंजाब की राजधानी बने चंडीगढ़ में पीजीआई बनाने को लेकर एक विचार उभरा और देखते ही देखते साल 1963 में सेवा, संघर्ष और स्वास्थ्य के सफर की
Yeah. Good morning, everyone, and I welcome you all to the 62nd Foundation Day celebration of our institute today. There are a few announcements to make before we start. The first is that please put your phones on the mobile phones on the silent mode, so that otherwise there's a lot of inconvenience that we face. And secondly, all the awardees and their families, along with the students, will have their refreshments on the first floor after the ceremony. Thank you. And I think the chief guest is on the way. The flight was slightly delayed, and he's on his way and would be reaching in another 5 minutes, 5 or 7 minutes, I think. Thank you. So we'll start in a few minutes. I've sent it. So I hope that you've put your mobile phones on silent mode. Our chief guest, Dr. Rajeev Bahel, Secretary to the Government of India, Department of Health Research and Director General, ICMR, escorted by Director PGI, has arrived. It's my privilege and honor to welcome each one of you on this exceptionally auspicious day to celebrate the 62nd Foundation Day of this great institute, which stands as the Mount Everest of patient care and research in North India. My humble request to the esteemed dignitaries to please take their chairs on the dais. It was on this great day that history was laid down and our first Prime Minister, Pandit Jawaharlal Nehru, inaugurated the hospital now named as Nehru Hospital on the 7th of July 1963. So we have gathered here today to commemorate 62 glorious years of its mammoth existence. As our tradition goes, We begin this day by invoking the blessings of the divine energy for prosperity and positivity. Lighting of the lamp has a rich cultural and symbolic meaning. The flames of a lamp represents purity, illumination of knowledge, dispelling of ignorance, and transcends us from darkness to light. Let us invoke the blessings of Goddess Saraswati to bestow knowledge, wisdom, eloquence, creativity, intellect, and learning. Now may I request the dignitaries on the dais to escort our chief guest, Dr. Rajiv Behel, to light this auspicious lamp. An anthem is a musical composition that defines an organization's history, traditions, and struggles. It has an enormous power to instill a sense of pride, patriotism, and passion in every individual linked to that cause. Now let us immerse ourselves into the mesmerizing PGI anthem and feel it from the core of our hearts.
आशाएं जीने की मन में जगाए, असीम ज्ञान की धारा बहाए। आशाएं जीने की मन में जगाए, असीम ज्ञान की धारा बहाए। शिक्षा, विज्ञान और स्वास्थ्य का ये सेवा संस्थान हमारा।
दीक्षा भी है यहाँ, शोध भी, कर्तव्य का है बोध भी। भारत के हर एक प्रांत से आए हुए हैं हम सभी। हर शख्स यहाँ जो आया है, उसे रोग मुक्त कराया है। जीवन यहाँ सभी की आस संजोया है, सभी की आस संजोया है।
विश्व कल्याण सर्व मंगलम उद्देश्य है हमारा। संकल्प है संस्थान का, लहराएंगे परचम। हम हैं PGI चंडीगढ़, हम हैं PGI
It's my great privilege to call upon our magnetic director, Professor Vivek Lal, to deliver his welcome address and also introduce our revered chief guest. Sir, please.
Dr. Rajiv Behel, the chief guest for today, Professor Digambar Behra, President, NAMS, Dean Academics, Professor Ratho, Dean Research, Professor Sanjay Jain, past directors, my worthy teachers, I wish you all a very happy 62nd Foundation Day for this great institute. Words always defy me when I come to the dais to talk about PGI, because I am a grounded PGIite. I have seen PGI for the last 40 years. Professor Behel, we were talking about a few things. I was posted in hepatology as a first year. First year is supposed to do all the groundwork. Groundwork का मतलब आप समझ जाइए, ठीक है? So if the boss would come at 8 o'clock, you were supposed to be there at 7 o'clock. The sad story is, if I came at 7, both the bosses were already there. They would come at 6:45. That was PGI of yore, the PGI which I grew up with. Professor Behel, you yourself a doctor, an iconic spearhead of research today. You did your MBBS from UCMS. One of the most distinguished PGItes is your class fellow. You did your MD from AIMS Delhi, sir, and then you went to the WHO. You will probably agree with me. You did your MD from Kalavati Saran. It's an iconic pediatric asset of this country. You would agree with me, sir, that when we talk about the glamour of technology, behind that lies the fierce blood and sweat of commitment. The students of today probably get blinded by the glamour of technology. What they don't understand is our founding fathers gave their life, blood and sweat to this glorious institute, and the likes of this institute, AIMS Delhi, NIMHANS Bangalore, so many others, to make them reach the pedestal where they all are today. And if we have to remain on that pedestal, we will have to have that same fierce commitment, remorseless motivation. I'm using the word remorseless because today we keep on talking about mere paas ye nahi hai, mere paas wo nahi hai. Remember, you will not get everything. I do not know whether that is available in heaven also, but it's certainly not available on earth and certainly not in PGI. But we make up for the lack of our infrastructure by our fierce commitment. Professor Rajvanshi बैठे हैं. When he started the Department of Cytology, he came from Singapore. He started the Department of Cytology, the first of its kind in India. Professor Dilavri, Professor Chawla started the Department of Hepatology, the first of its kind in India and in Asia probably. The first DM in hepatology was from our department. And it was all fierce commitment. It was all ruthless motivation, ruthless motivation. That is all I say, Professor Behel, to all my students. आप नाराज ना होना जब मैं आपको कहूँगा कि repeat what I said at the cost of being repetitive. That is what we need to tell ourselves, and that is what we need to tell our faculty, our healthcare professionals. That is what counts in the end. I was telling you about the BrahMos missile. Everyone sees that the BrahMos punctured Pakistan in Pakistan. But it took more than 2,700 attempts to reach that level. 2,700 attempts. It didn't begin as a BrahMos. It didn't begin as the way we smashed them. 2,700 attempts, faltered, but not giving up to reach where it is. That's commitment, and that's the end result, and that is what PGI is all about. I welcome you all, sir, and I welcome Professor Behel in particular. Last night he landed from Trump land. I call USA Trump land these days. He had gone there, long flight, and he's here today. And I thank him for being here. Luckily, the flight landed on time so that we can start the function on time. my heartfelt gratitude for what you are doing for PGI sitting in Delhi, sir. You have been, I must say, a very strong pro-PGI, non-PGite. I'm seeing the way you're going around, and the way you are promoting the cause of this institute. Once again, eternal gratitude for that. Namaskar, Jai Hind.
Thank you, sir. And on this auspicious day, we have amongst us our guest of honor, Dr. Digambar Behera. He is Professor Emeritus, PGI Chandigarh, and he is the President of National Academy of Medical Sciences, NAMS, New Delhi. And for his introduction, I call upon Professor Ratho, Dean Academics, on the dais.
Good morning and a warm welcome to all of you on this occasion of the 62nd Foundation Day celebration of our institute. The chief guest on the dais, Dr. Rajiv Bahl, the Secretary, Department of Health Research, Government of India, and the Director General, ICMR, New Delhi. The guest of honor, Dr. Digambar Behera, the Professor Emeritus, former Head, Department of Pulmonary Medicine, and the Dean Research, PGI Chandigarh. Professor Vivek Lal, the Director, PGIMER. Professor Sanjay Jain, the Dean Research, PGI. The dignitaries of the dais, the sub-dean are the sub-dean academic, the medical superintendent, the DDA, the FA, all former directors and former deans, as well as former professors of the PGI Chandigarh, the Registrar PGI, SHC PGI, the distinguished guests, esteemed faculty, respected colleagues, and the brilliant students. It gives me immense pleasure to introduce our guest of honor, the person who is well versed in this locality and is a well-known clinician, Professor Behera. He is a pioneer in lung cancer chemotherapy, and he happens to be the founder president of the Indian Society for the Study of Lung Cancer. Besides many, currently he occupies the most prestigious presidency of the National Academy of Medical Sciences, India. He has been the director of the National Institute of Tuberculosis and Respiratory Disease, New Delhi, for a long period of 5 years. Sir, there are many accolades to his credit. To just name a few, the Padma Shri, one of the prestigious Padma Awards of Government of India, the B.C. Roy Award by Medical Council of India as an eminent teacher, Hariom Ashram Research Award, and the B.P. Koirala Memorial Oration are just few to name. I think everybody will agree with me that he is a clinician and a researcher par excellence. Look into his publications, crossing over 600 publications in reputed journals of national interest report. Such a researcher and a clinician, I think befitting today on this stage when we are having Dr. Rajiv Bahl with this intention that a clinician coming out to be a researcher, the best person sitting behind. Just to have my view, he is a man of perfection and commitments, and always he has been very helpful to many. Whosoever went to him for his help, he has offered the help as far as possible. We are grateful, sir, for sparing your time for this occasion. Thank you very much. Jai Hind.
Thank you, sir. May I now call upon our chief guest, Dr. Rajiv Bahl, Secretary to the Government of India, Department of Health Research, and Director General, ICMR, to deliver the Foundation Day address. Sir, please.
Respected Professor Behra, Professor Vivek Lal, Director, PGI, Dean Academics, Professor Ratho, Dean Research, Professor Sanjay Jain, all the previous directors of this great institution, ex-faculty, current faculty, students. It gives me great pleasure to be here today to talk to you on your foundation day, 62nd foundation day, 62 great years of this institution. And as Professor Vivek Lal was saying, we are very proud of, every Indian is proud of having institutes like PGI Chandigarh. So my great felicitations and respect and appreciation for the work that you all are doing and have done in these 62 years and will continue to do that over hundreds of years. So today I wanted to take this opportunity to talk to you about something that is very close to my heart, and that is about physician scientists and innovators. So not only scientists but also innovators, and what institutions like PGI should do or can do even further than what they are doing in order for us to have more of these, and also to give you a little bit of flavor of how ICMR is working towards this goal. So it is, to this audience, I don't need to say why research and innovation is important in medical institutions. In fact, today, when clinical care used to be at one point in time, AIMS and PGI and other institutes would be so much par excellence in clinical care compared to everybody else. Today, a lot of that has been taken by the AIGs of the world and many others, in terms of private institutions, others which do excellent clinical care because of infrastructure, resources, others. But the teaching and training as well as research is what sets institutes apart, which really make the PGIs, the PGI Chandigarh and any other institute like that great. So there are things that we can only do in medical institutions, such as evidence for finding out what is important, why they can be very, we cannot create technology on our own probably, but suppose you have to make a new device. I've seen so many people working in IITs and others who work on things which are probably not even as important as kind of the effort on which they are putting into it. So working with our technology partners to identify the unmet healthcare needs is the first thing that I would say. The second is, only physicians and physician scientists can actually prove safety and efficacy of any new technology that we produce. And thirdly, we are the ones who are also going to be able to take it to scale, to do the implementation research towards that. And all that will catalyze not only Swasth Bharat, but also Viksit Bharat. So just talking about this engineer doctor industry, the IITs, the institutes, industry partnership in bridging medicine technology and eventually bringing it to the market. So our role as physicians, identify the clinical needs, validate solutions through robust trials, ensure patient safety, ethics, usability, etc. But the engineers will eventually design and develop the new devices or diagnostics and lead the simulation, software development, initial analysis of data, etc. And eventually, very importantly, the third part of this whole, the third pillar is industry. Normally, we are very wary of industry, and I think we should not be, because no product will reach the market, will reach the people we want to reach. Even everything that you are using today in your clinical care is produced by industry, whether it is pharmaceuticals, whether it is vaccines, devices, or diagnostics. They are all eventually have to be made by industry for it to reach people. And creating the very strong partnership of these three is what is going to convert science and research into innovations that can reach our patients and the people. As an example, I'd like to tell you about the ICMR DHR Centers of Excellence at IITs working together with institutes like the All India Institute of Medical Sciences and many others, where in 6 IITs, the ICMR has funded more than 200 crores of projects in which already in 2 years, 27 new devices have been developed, and many of them, I think almost all of them, are either approved or are in clinical trials. And many more are on their way. The pipeline is our target was to have 50 devices in 50 years, devices in diagnostics, but it is going to probably be crossing 100 over 5 years. And a few examples are shown here, like what is called Ceribo for detection of brain hematomas. And many of these devices we showed to Mr. Bill Gates during his last visit. And everything he saw, he was asking his colleagues, did we have anything to do with it? And they all said, no, this is all done indigenously by India, by our own institutions. And he wrote a very nice letter and many tweets saying that the things that are being done in India have the potential to not only change India and healthcare in India, but across the world. So it's just an example. This device is something that was produced, created by an Indian institution and an Indian startup, which uses infrared technology, and you can just put it on the forehead, 2 sides, on the parietal lobes behind. In 2 minutes, you will know whether there is any hematoma or not. So you can imagine the uses that this device can have. Or then Dr. Vinod Paul asked me, I need a lab. If I have to do non-communicable diseases, I need a lab that can be established at any Ayushman Arogya Mandir, at any health and wellness center. So we challenged these IITs, and IIT Guwahati came up with this, what is called the Mobi Lab. And it can do almost all of these tests, say all the biochemistry, serum albumin, bilirubin, protein, almost all of them. All the others, they are not listed here. But very important that if we cannot do HbA1c, I cannot have a diabetes program. If I can't do it right at the doorstep, right at the point of care, it is extremely difficult. So this is almost a lab in a small suitcase, can be taken anywhere and set up and the biosensors they have used, they just get the very nice results but of course not at scale. We don't even need it at scale. They do about 4 samples at a time, but it can be done anywhere. So these type of innovations that have come through is something that gives great hope that we can move into the future creating many, many more products across the country. And the strategic collaborations that we have, I'm showing on these 2 maps. On the left side, you will see that there are 2 types of institutions marked in red and those that are marked in green. And the ones in green are the centers for technology development. That is IIT Delhi, IIT Hyderabad, Bombay, the ones that I spoke about. The AMTZ, many others. Kanpur, IIT Guwahati, the green ones. The red ones were created about a year ago. When we started producing these devices, we had to test them. We had to find a place to evaluate them. So we've created these centers at PGI Chandigarh, AIMS New Delhi, Safdarjung Hospital, ACTREC Bombay, Armed Forces Medical College, St. John's, Indian Institute of Science Bangalore, Shri Chitra Trivandrum, AMTZ. And all these are centers for advanced research that ICMR has created in the past 1 to 2 years for evaluating these technologies. Whatever technologies are being created by not only these IITs but also outside and by industry, we are going to have them evaluated at these centers so that they can come to get the approval of the Drug Controller General very quickly. Similarly, we have a network of clinical trial institutions, which also I'm very happy to say PGI Chandigarh is one of the 4 institutes that actually does phase 1 clinical trials outside of CROs and industry. So PGI is a very core partner in the Intent Indian Clinical Trial Education Network, but you can see 80 institutes across the country. There is that huge number around Delhi, Chandigarh, this area, but they are spread across the country to do phase 1, 2 and 3 clinical trials. What we have also done, and again PGI is a very important participant, is young faculty PhD program. So why a PhD program for physicians? Because we believe that PhD gives a kind of training in research that when it is added to clinicians' armamentarium, makes them even better scientists. 3% of all physicians in the United States have a PhD. That percentage is not even 100th in India. So how do we create that? This was about 20 years of lots of effort of lots of people trying to think about how to get the MD PhD or physician PhD programs in India. But they were not very successful. And when we analyzed it, I felt that the main reason was the lack of demand. That any MD who would like to get into even faculty of an institute like PGI was better off doing a DM or MCH and then a senior residency rather than a PhD. And that is unfortunately the case, that we were not able to even recognize the period of PhD, even if it is in a clinical subject, for entry into faculty, for example. So we turned it around. We said, okay, who has a job that already requires research. And I found that there are at least two. One, medical scientists in ICMR, and two, the faculty of medical institutes. So what we did is that we said anybody under 45 who is a faculty member will offer them this PhD program, but only in institutes which have a culture of research. And so we've selected only 28 leading institutes out of the first 50 NIRF ranked institutes, which we will expand slowly to at least those 50. But the idea is not only to let them do a PhD, if their institute allows a PhD, but also we created a ICMR, ACSIR, which is the CSIR Academy of Scientific and Innovation Research. We can register anybody, even those who do not work in medical colleges that can offer PhD programs. So about half of these colleges offer a PhD and the other half don't offer a PhD program. So they can now register in ACSIR as well, or their own institute. But importantly, we are giving a grant of up to 50 lakh rupees to anybody who will do a PhD if they are nominated by their institution and then selected by ICMR. So each institute will have at least 3 PhDs of the ones we have selected, the 28 institutes, at least 3 PhDs every year. So this is an opportunity, and in 2024 the first batch of 64 young medical faculty were enrolled and are currently pursuing this PhD program. Grants. Just to talk about 2 types of grants. One, overall, and second, particularly for development of new products, new medical healthcare technologies, which are innovations that we actually bring to the people. So the small grants, as you know, are kind of, we call them small, but they are up to 2 crore rupees for 3 years. So PGI Chandigarh in the last 2 years has won 74 such grants. This is the second highest, of course, in the whole country after the All India Institute of Medical Sciences. But importantly, half of them are in development research, which means that these are either working on new interventions or new products. So this is of, again, something which was not what was happening maybe 2-3 years ago, before COVID certainly not. Most of the research was descriptive in nature. But now you see, out of the 74 grants PGI has won, small grants, 38 are in development division rather than descriptive research or discovery research. They are developing new interventions. Similarly, intermediate grants, they are grants up to 8 crore rupees. 12 such grants have been again won by PGI over 2 years. 9 of those are in development research. There are 2 centers for advanced research that have been established. One out of them is again in development research, and one first in the world challenge grant was also won by, out of 25 that we gave, and this was not only for medical institutes, this was for anybody, including industry. This was last year we did the first such challenge, which was essentially inspired by Chandrayaan. We said if Chandrayaan can land on the moon, on the South Pole, first in the world, we cannot be left behind. And to instill that confidence in Indian scientists and researchers, particularly in medical researchers, we launched this challenge to say, if you do anything, make any device, any product, any knowledge that is first in the world, you have to prove that nobody else is working on it, or we are working on it but they don't have it, then we will give you a 1 crore rupee grant, no questions asked. Just an idea, 1 crore rupees. If you already have developed that idea and it is at a stage where it can go for some kind of evaluation, then 4 crore rupees. And when it goes to that situation where you want to do the decisive trial, then 8 crore rupees. So if you can get at any stage, or if you get the 1 crore, then within the 2 years at any time when you are ready, you can ask for the 4 crore grant and then for the 8 crore grant. You just have to cross that milestone. So again, 2 things are important here. The idea is that maybe one of these 25 that we will fund every year will actually produce something which is first in the world, which means that it would be a great investment, high risk, high reward. But more importantly, it is to give people in India, our scientists and physicians, scientists in particular in India, or any other innovator in India, the idea that we can be first in the world. And the government of India will fund you if you have ideas that are first in the world. So I'm very happy that PGI has at least one of those grants last year. So this year, you should look out for that. It is going to come very, very soon. And here PIs can involve startups, industry as collaborating partners. Even industry can apply. We have given grants to small industry, not only to in medical institutions or health institutions or technology institutions. We've also launched, to support physician scientists, a program called Patent Mitra. Now, there are 2 of these programs after research. One is Patent Mitra and one is MedTech Mitra. I'm going to talk 2 minutes each on these 2. The idea of Patent Mitra is that filing patents is kind of something that is very difficult for. When I was thinking of myself, I was working in All India Institute of Medical Sciences where I did my PhD and then worked as a scientist. And we were very scared of 2 things. One, when we got into the idea of doing anything which was beyond our comfort zone of publishing in a medical journal, we would publish in the Lancet or BMJ or any other journal. But when it came to patents, filing, lawyers, it was very difficult. Even more difficult was technology transfer, going to industry, making partnership, drug controller. Anything that required a drug controller approval was kind of almost like gave you flutters. It's too difficult. So those are the things we have tried to address through these 2 initiatives. Patent Mitra will anybody who has anything that they think can be patented can apply. It's an online portal that ICMR is running. You can apply. What will ICMR do? It will help you doing the patentability assessment. Is it patentable? Does it have something which can be patented? And if it is patentable, then ICMR will also do the patent filing. So we've engaged consultants firms for doing the patentability assessment. We've engaged lawyers, 10 law firms, some of the leading law firms in this area, to be able to file patents. Any prosecution that is required will also be supported, and maintenance of patent for up to 5 years. But one has to then exploit those patents. It's not just having those patents. And that's why we have the technology transfer facilitation. So ICMR will be kind of the broker between, honest broker between people who hold technology and those who are asking for technology, which is the industry which will be able to take it forward. And the hand-holding support for this kind of, whether the technology is ready to be transferred to industry, execution of licensing agreements, validation support. So many of these things as government servants, we are all very, very scared to do when you are in institutes, that something will go wrong. And that's why we thought that if ICMR is behind this, then people can have a little more confidence that they will not be kind of found fault to why are you talking to industry or why are you moving towards this. Because without this industry linkage, it is simply not possible to convert the innovations that we will make into something that the patients will be able to use. So this Patent Mitra is open to ICMR institutes. It is open to all ICMR grantees. So those two are kind of A and B. But third part is it is open to everybody else as well. So it is not only big, there are three parts. So you can go into, if you are an ICMR institute, you have one entry. If you have a grant from ICMR, then you have second. But it doesn't matter. Even if you have an international grant or grant from any other Indian agency or no grant at all, you can still apply through this and all the support to file patent will be provided. Our idea is today about 1,000 patents are filed in health, in the domain of health, and I want that to be 10,000 in the next 3 years per year. So the idea is to, if we do more of patenting, we will probably have more technology that we can transfer and more new products that we can make. The second thing that I'd like to tell you about a little bit is what we call the MedTech Mitra. This is another thing that we have created as an end-to-end process of hand-holding and support. Now, you must have heard about the valleys of death for innovations, and those are the valleys of death. Some things fail, there is a great idea, but a prototype can never be created. Then there is no proof of concept, and then somehow some animal trials, other things are required, and by that time you do all that, it falls in that valley of death and it's gone. Sometimes people are able to cross these valleys. And then there is a very deep valley, which is to get through the Drug Controller General, the CDSCO, to get an approval. And that requires clinical evaluation, that requires clinical trials, which are regulatory in nature. And people find it extremely difficult. I have found it extremely difficult when I was a researcher in between the 90s and 2000, early 2000. And then comes another valley, which is even wider, not as deep maybe, but very wide, that you have a product. A company has a product, but then nobody uses it. It's a great product, but nobody knows about it. So it is, everything is dependent on that company, that they are able to go market it, go to each doctor, each institute, and somehow convince people to use it. So to overcome that, what we have is a new attached office in DHR, which is called Health Technology Assessment. And I think Shankar Prinja is here. Dr. Shankar Prinja is a great help in that. He has been one of our top people who has helped us set up centers across the country for cost effectiveness analysis. And doing these cost effectiveness analysis and providing those results to states and to the central government really gives them the confidence that they can procure this product at a price that has been set by the HTA study. Now, even they are scared. If they buy something for 200 rupees, somebody will question them, why 200? Why not 150? So by doing this kind of health technology assessment, by calculating what is called an ICER or an incremental cost effectiveness ratio, we are able to then say that how beneficial is A compared to B, and how much should we be able to pay, or how much can we pay for it to be cost effective. Then we also have guidelines. We have a center for guidelines that will take some of these and actually make guidelines for use of those technologies if they are good. And there are n number of partners, but the most important partner here with ICMR was CDSCO. So in Punjabi they say कि क्या कहते ने चोर नू थानेदार बना दियो, ऐसा. So what we said is that we convinced the Drug Controller General, and they were very ready to be convinced, that like FDA, India should also, the DCGI should also have pre-IND meetings, which is pre-investigational new drug meetings with the innovator, where we actually work with the innovator to say, how do you produce data that will make you go through the regulatory process, rather than holding it like this and then end में saying, देखा फिर fail हो गए, very nice, we failed you again. But they were really forthcoming, and to date, in 556 days that this program has been launched, 488 medtech innovators have been helped through meetings, one-on-one meetings with the group that involves Bureau of Indian Standards, CDSCO, ICMR, many experts who can give advice on how to take the product forward. Also, in addition to hand-holding, so regulatory strategy is there, but also if you have to do a preclinical study, let's say you have to do a study in at least two different species. Now, most facilities, most institutes have a small animal facility. But when it comes to large animals, they don't have that. So we have now made a new facility in Hyderabad, which has from mouse to horse, all kinds of animals, where we can do any test that is absolutely necessary for a new drug or device to be taken to human before they can be taken for human trials. And the intent network that I spoke about, all that is interconnected now into one system of promoting this. So the idea to tell you about this is that there is help and there is hope. If you have new products, new ideas, you can get both the research money, the patenting, transfer technology, and actually take it through the regulatory system with your industry partners. And I talked about already the National Animal Resource Facility, which has dogs, non-human primates, the goat, sheep, pig, rodents, all kinds of animals. The last thing I want to talk about is policy for biomedical innovation and entrepreneurship. Now, this is again something that eventually I feel there is one thing that changed the innovation in healthcare in United States. It was this, that they allowed their physicians and their medical care professionals to actually join hands with industry and actually make profit out of that. Now, this is somewhat controversial. Some people think that we should do only things which are for the goodness of your heart. But we also know that some amount of profit, some amount of what recognition that you get goes a long way for promoting innovation. So what this policy, this is an approved policy by the government of India, However, it is not implemented in most institutions. So I would like to see if you can examine this and see if you can actually implement it. Our own Indian institutes of technology, IITs, are far ahead of us. All medical institutions, we are just still no, we won't touch this. IITs, they are buzzing with energy. People are making now crores of rupees if they are good. They are starting their own startup companies. They are working with this. You need that energy to come into the medical institutes, and that is my reason to show you. This was approved on 24th of February 2022. It's been 3 years by the then Minister of Health and Family Welfare, Shri Mansukh Mandaviya ji. But it enables academic innovators to become entrepreneurs, initiate startups for converting prototypes to products in a regulatory compliant manner, facilitates sabbatical leave for academic entrepreneurs, provides roadmap for institutions for creating infrastructure and enabling startups, and much more. And there are rules that you can set up. And there are, as I said, IITs are a great start. They have all those policies. You can just start with those, that what percentage you get, what the company will get, what the institute will get. On a personal note, I told Dr. Vivek Lal, my son finished his PhD in United States, and he has, his supervisor is 5 years older than him. So my son is 28, he's 33. So the 33-year-old and a 40-year-old, both of Indian origin, started a startup company last year, about 18 months ago. And it was evaluated at $4.5 billion US last week. And these two professors at CMU, Carnegie Mellon University, they have taken now 5-year sabbatical to run this company. The university is very happy. They have a stake in it. They have some whatever 5% or what share in the company. So they are saying, very good, go and create something first in the world, beautiful. Go ahead, bring some laurels to this institution, not only through the other things like teaching and other, but also through innovation. So some people can certainly be offered such flexibility. So ICMR, DHR, we have created these Viksit Bharat goals. We were asked by the Honorable Prime Minister of India last year before the elections that when he said, when we come back after the elections, I want to see each department come with the 5-year plan or goals to create Viksit Bharat. And we've developed these 6 goals just for you to see. That one is accelerate development of indigenous, affordable and accessible health technologies, including frontier technologies like gene therapy, robotics, others. Develop solutions for difficult and resistant health problems like NCDs, which are increasing mental health, cancers, antimicrobial resistance, things like anemia, fair and childhood malnutrition, which have been plaguing us for years. We've been trying, but we need to get really cutting edge solutions. Develop and deploy digital health solutions, which is what is going to be, we like it or not, AI is already here and is going to take whatever, like technology or not like technology, it's here. It will never replace human commitment, but you cannot not use the technology. You have to use and make the best use and not be left behind on technology. Using research evidence in public health programs is our 4th goal. Develop technology enhanced surveillance models for pandemic and outbreak preparedness, including development of medical countermeasures. And finally, another very important thing, achieve high global ranking of Indian institutes in medical and health research. Because when I see that there is not a single institute in top 100 in research rankings, I feel very bad. I mean, I think AIMS is about 200, PGI is 400. This is not where we need to be. This is not what we want to do. We want to be in best rankings in terms of university rankings and in terms of research rankings. And we can do it, and we are trying to, my goal here is to speak with you and encourage you all, to encourage your future generations of youngsters, both faculty and students, to do the same. Thank you. Jai Hind.
Thank you, sir, for that eye-opening and a path-defining talk. We are sure that this is the way to embark on for a Viksit Bharat. So today, the 7th of July 2025, it's a momentous occasion in the history of PGI Chandigarh. This was the day that PGI came into existence, and then it embarked on an incredible journey of state-of-art patient care and pursuit and enhancement of medical knowledge, making it the biggest temple of learning in North India. All the credit undeniably goes to our revered forefathers who nurtured this organization as their child and passed the baton to the others. This journey was really incredible with ups and downs, but the end product is PGI Chandigarh shining brightly like a star in the universe. So on this day we come together and celebrate to honor our heritage and history. On this memorable day, the outstanding employees of this institute are given awards for their meritorious and selfless service. These employees have done commendable work and have gone beyond the call of their duties to serve this institute. I request all the dignitaries on the dais to please come forward for the award ceremony. So the first awardee today is Mr. Sukhwinder Singh, Hospital Attendant, Office of Senior Administrative Officer. He has worked in PGI for the last 12 years. Mr. Karan Singh, Hospital Attendant, Department of Virology. He's been in PGI for the last 31 years. Ms. Sheila Sahota, Hospital Attendant, General Branch, Senior AO Office. She has served this institute for the last 15 years. Mr. Krishan Pal, Laboratory Assistant, Department of Pulmonary Medicine. He has served the institute for 17 years. Ms. Sunita, Junior Administrative Officer, Service Book Section, Carom Block. She has been in PGI for the last 26 years. Mr. Pavan Kumar, Mr. Pavan Kumar, Junior Administrative Officer, Security Establishment. He has served the institute for the last 26 years. Mr. Satish Kumar, Assistant Administrative Officer, State Branch 1. He's been serving this institute for the last 32 years. Mr. Madan Lal Pant, Assistant Administrative Officer, Establishment Branch 2. He's been serving this institute for the last 32 years. Ms. Veena Rani, Assistant Administrative Officer, SR Section Establishment Branch. She's been here in PGI for the last 31 years. Ms. Paramjeet Kaur, Stenographer, Department of Anesthesia and Intensive Care. She's been in this institute for the last 29 years. Mr. Sanjay Kumar, Stenographer, Department of ENT. He's been working in PGI for the last 22 years. Ms. Sushila Kumari, Private Secretary, Medical Education and Research Cell. She has served this institute for the last 31 years. Mr. Tarseem Lal, Principal Private Secretary, Office of Dean Academics. He's been in this institute for the last 40 years. Please clap, everyone. Ms. Varpreet Kaur, Senior Technician Laboratory, Department of Medical Microbiology. She has been in PGI for the last 19 years. Mr. Kaka Singh, Technical Assistant, Department of Biochemistry, has served this institute for 32 years. Miss Radha Uppal, Technical Assistant, Department of Cytology and Gynec Pathology. She's been in this institute for the last 37 years. Ms. Kamaljeet Kaur, Technical Officer, Department of Anesthesia and Intensive Care. She's been serving this institute for the last 27 years. Mr. Rajwinder Singh, Senior Technician, OT, Department of Anesthesia and Intensive Care. He has served this institute for 25 years. Ms. Thigam Subadani Devi, Nursing Officer, ENT OT, NHE. She has been in this institute for the last 16 years. Mr. Prem Shankar Malav, Nursing Officer, Cath Lab, Department of Cardiology. He's been in this institute for the last 18 years. Ms. Parminder Kaur, Nursing Officer, Private Ward, Nehru Hospital Extension. She has served this institution for 16 years. Ms. Manshinder Jeet, Senior Nursing Officer, Renal Transplant OT, has been in this institute for the last 27 years. Ms. Lalita Das, Senior Nursing Officer, ENT OT, Nehru Hospital Extension. She has served PGI for 26 years. Ms. Poonam, Assistant Nursing Superintendent, Main OT, Advanced Eye Center. She's been serving this institution for the last 34 years. Ms. Sonia Rohela, Storekeeper, Department of Obs and Gynae, has been serving this institution for the last 11 years. Mr. Dilbag Singh, Steward, Department of Dietetics. He's been serving this institution for the last 32 years. Ms. Rupinder Jeet Kaur, multi-purpose worker, Department of Community Medicine and School of Public Health. She has been in PGI for the last 25 years. Mr. Pankaj Kumar, Darkroom Assistant, Grade 2, Department of Radio Diagnosis, has served this institution for the last 27 years. Mr. Sahib Singh, Driver Grade 1, Engineering Department. He's served PGI for the last 29 years. Ms. Babu Devi, Pharmacist, Grade 1, Pharmacy Department. She's not here. She's gone abroad. So her sister-in-law, Usha Saroya, will receive the award on her behalf. And the last on the list for this year is Mr. Preetham Singh, Photographic Assistant, Department of Clinical Photography, who has served this institution for 23 years. Now, as a mark of our deep respect and gratitude exuding from the core of our hearts and actually from our sinoatrial nodes, we now move on to facilitate our chief guest, Dr. Rajiv Bahel, and our guest of honor, Dr. Digambar Ribera. For this, I humbly request all our dignitaries to please participate in this ceremony. Thank you, sir. Now, things are incomplete without thanking every soul who has contributed to organize this function. For this, I request Professor Sanjay Jain, Dean Research, to kindly propose the vote of thanks.
Good afternoon, respected Professor Bahel, Professor Behra, Professor Vivek Lal, Professor Ratho, esteemed faculty members, distinguished guests, and most importantly, our newly joined residents, the healers of tomorrow. It's my privilege and honor to deliver the vote of thanks on this special occasion as we celebrate the 62nd Foundation Day of our institute. Sir, today is a very special day because today new residents have joined us. As you know that PGI gets new residents on 1st of January and 1st of July. Today, approximately 150 to 200 residents have joined or will be joining very soon. First and the foremost, I would like to express my sincere gratitude to Professor Bahel for his truly inspiring and thought-provoking words that carry the promise of progress and new discoveries. Sir, people invest in industries, but we at PGI invest in our residents and our faculty members. So regarding your words about patents and startups, let me tell you that PGI is very much sensitized to the new changing paradigms in the world. We have set up a separate patent unit, and you will be happy to note that in the last 1 year, we have filed and already got about 10 patents. And we hope that by next 3 to 5 years, that's the vision of the director, that we should be getting about 50 patents per year. Now for the startups, in the last 3 months, again, you'll be happy to note that at least 2 faculty members have approached me, and we are in the process. I would say that's at the nascent stage, essentially because of the fact that we have no exact SOPs to how to go about it, although everything is in place, but how much would be the sharing, what would be the legal implications, etc., etc. There are many those things which we have to sort out, and I can assure you that very soon we will be starting this program too. At the same time, I would like to extend my heartfelt gratitude to Professor Behra for being with us. He happens to be my teacher, my mentor, and again, he was my guide in the thesis which I did about 40 years ago. I thank Director for his guidance and his commitment to the academic excellence. To our faculty members, thank you for your unwavering dedication towards teaching, mentoring, and shaping the next generation of clinicians. Your presence today reflects the supportive ecosystem we are proudly upholding. To our administrative staff and the organizing committee, thank you for coordinating today's program with such care and professionalism, ensuring that our new residents feel not just welcome but truly at home. To our newly residents, we warmly welcome you to this journey of growth, responsibility, and lifelong learning. You are not just joining an institute, but an institute of service, integrity, and clinical excellence. The path ahead, I can tell you, will be very intense and transformative, intellectually, emotionally, and ethically, but rest assured, you are not going to be all alone. The faculty is always with you. We look forward to your contribution, your curiosity, your compassion, and your commitment to both science and humanity. May your time be very rich in experience and fulfilling in purpose. But please remember, dedication and commitment are the two qualities ingrained in the DNA of every PGI. Our institute stands for integrity, empathy in every interaction, and curiosity in every question asked. Once again, thank you for all being here, and let us move forward together in service, in learning, and in patient care. Thank you, and Jai Hind.
May we now rise for the national anthem. Due to the paucity of space, I request the dignitaries and the faculty to please move for high tea in the room which is adjacent to this hall, and I request the awardees, their families, and the students to kindly move to the first floor for the high tea. Thank you very much. Jai Hind.